Many infants and children are now receiving tube feeding at home as part of a medical treatment plan. Tube feeding can be successfully managed at home once education of the family has been completed and formula, supplies, and equipment are obtained. In my many years of experience as a nutrition support nurse, I've found that almost all families can learn and manage home tube feeding if they have motivation and are given support and the opportunity to learn. There can be occasional mechanical problems associated with your child's feeding tube or with a feeding pump. Many of these problems can be managed at home. Feeding tubes may occasionally become clogged. If a tube becomes clogged, the following solutions may resolve the problem at home. First, make sure the feeding tube is not kinked. Second, if the feeding pump alarms to signal a clog, it may be cleared from the tube by gently aspirating and attempting to irrigate with warm water. Do not use soda or juice to attempt to irrigate or loosen the clogged feeding tube, since these fluids have not been shown to offer any advantage over water. The best strategy to prevent clogging of a feeding tube is to flush or irrigate the tube with a small amount of water before and after medication administration and after bolus feedings or when discontinuing a continuous feeding infusion. Flushing a child's enteral feeding tube at least once daily may aid in keeping the tube clear. If any type of feeding tube cannot be cleared with aspiration and irrigation attempts with water, and you have not been taught how to replace your child's tube, always seek further guidance from your child's healthcare provider. If your child has a feeding pump and the pump malfunctions, recheck the feeding administration and pump setup. Make sure the pump has been fully charged by plugging the power source into a working electrical outlet. If the pump continues to alarm or malfunction, contact your medical supply company to request guidance regarding repair or replacement of the equipment. If your child's feeding tube dislodges or is accidentally removed and you have not been instructed when and how to replace or reposition the tube, contact your child's healthcare provider immediately for guidance.